Hi everybody, my name's Dr. Marisa Magiros. I am a GP and I'm the Director of Education and Training of International Medical Graduates in Canberra Health Services. I'm very pleased to share this topic on cultural impacts on communication and feedback. So this session has been designed as an interactive session with activities interspersed, and I've left them in for this recorded session so that you can either refer to them in your own time as an individual, or you could use it for group or team learnings, and there's even a role play in there for those who feel brave. I would like to acknowledge my previous GP medical educator colleague, Dr. Catherine Casey, who co-developed this work and co-presented this work with me in the past for several or many years in GP training, and we were lucky enough to go to AMI in Barcelona this year as well. I work on the lands of the Ngunnawal and Ngambri people in Canberra, and I'm currently here on the lands of the Gadigal people of the Eora Nation. And I pay my respects to elders past, present and emerging. We live in a globalised world, which means that healthcare is also globalised. The data from the World Migration Report of 2024 estimates that there's 281 million international migrants across the world, and that was in 2020. In 2021, 19% of doctors working in OECD countries had obtained their medical degree in another country, and that's about 9% for our nursing colleagues. Even if we don't move places, the world does come to us, which is important. So these two quotes reflect that. So a bit of data about Australia. As we know, it's a very multicultural place. Now, 31.5% of Australians were born overseas, with 22.2% having at least one parent born overseas. Data from 2023 shows that in Australia, half the doctors registered to practice in Australia were educated internationally, and this list of 10 countries shows where most of that workforce comes from, and they are in descending order. So India's 21.3%, United Kingdom 19.1%, South Africa 8.2%, Sri Lanka 5.5%, and then it's less than 5% for the other countries, around that 2 to 3% mark. I always like to look at who's in the room, so look at who's in your team, in your workplace, and realise what a diverse bunch we are, which reflects the diversity of the data that I've just demonstrated. So thinking about, where did you study? So I studied in Australia, but I have Greek heritage. What languages do you speak at home? Are your family members from different countries? Just a little bit of an insight into what that looks and feels like. This research helps us not only in the workplace, but it also really helps us to understand the different cultures and spaces that we navigate, and can help us to maybe relate better to ourselves and our parents and our family members. The learning objectives are to explain research on cultural differences in communication and feedback, identify situations in your educational context where cultural differences may impact communication and feedback, and integrate some practical tips to navigate these challenges. When I deliver this, we talk about it being a safe space. Most of us have a deep protective instinct for the culture we consider our own. Though we may criticise it bitterly ourselves, we may become easily incensed if someone from outside the culture dares to do so. So take that with you. A very quick comment on cultural intelligence. So when I was learning about this work, then I recently learned about cultural intelligence as well. Like when emotional intelligence has come to the fore, and we've learnt more. So 4 factors. Again, another framework. Think about, cultural intelligence of your health and education system. There's drive or motivation, actions, which are behaviours, knowledge, that cognitive ability, and that metacognition and strategy. So again, that's just a taster, and there's more reading that you can do in that space. So why am I talking about this, and how have I reflected? As I said, I'm Australian born, but I do have Greek heritage, and interestingly, so my dad was born in Greece on the little island of Kythera, but my mum's parents also come from that same island. When we were 2, we went to Greece and lived there for 4 years. I'm the eldest of three. So my sister and I were born in Australia. My brother was born in Greece. I went to school in Greece with a proper little Greek accent. And at the same time, my mum was teaching me Australian kindergarten by correspondence, and we came back to Australia in 1980 for me to go to year one. Since then, I have returned to Kithra many times, and I went as a medical student and did my medical elective and lived there for 3 months, and that was completely eye-opening. I'll give an example of that shortly, but I've also lived and worked in England and in Ireland and on cruise ships for 2.5 years prior to my GP fellowship. So I've interacted with many different cultures and health systems. So when I did my elective in Greece, I was just blown away. So say I had gone in as a patient and I'd taken, say I had a partner and I went with them, the doctor would have spoken to my partner about my symptoms. That's just the system there. To the point that, someone else can share your story. So that was very different to the Australian health system. And another example that always stands out was there was a new young mother who was being seen by the obstetrician who visited the island, and by nurse/midwife. And this mother was from Albania, so there's that intersectionality of migration. But they were talking about breastfeeding, and the nurse reached out and squeezed the mum's breasts without permission, without consent. Like, that would have been assault in Australia. So these different things that are just accepted in health systems. When I worked in Ireland, I was working in ICU, and in Australia, it would be customary, if you had an end-of-life conversation, to document the do not resuscitate status. Anyway, I did that once and I was chastised because it was not the done thing, but I was at peak Dunning-Kruger curve, so I was really inconsiderate of how culturally inappropriate my behaviour was as a visitor to that health context. Kath shares a wonderful story of having some friends from Zimbabwe. So they had this family, they'd been friends for 2 years or so, and the family had come to their house many times to share meals. And at one point her husband said, so how do you invite friends over in Zim? And the response shocked them. It was like, oh, if you're a true friend, you don't get invited over. We only invite people we don't like. True friends just ring up and go, hey, I'm in the area, I'm coming by. And so that challenged assumptions. And interestingly, we shared that story at Amy, and someone from Zimbabwe came up and said, oh my God, that's why I've been feeling so lonely here in this new country that I'm living, because I'm waiting for people to drop in, and that's not the cultural norm here. The first activity I usually ask people to do is have a chat about their experiences. Usually the room is a buzz, which is great. Often thinking about travel stories helps people to think about those differences, because that's often when we feel the most, for me, Australian. The book that this is based on is called The Culture Map by Erin Meyer. Now, Erin grew up in small town USA. She married a Frenchman and moved to Paris, and so she's a professor in cross-cultural management at an international business college in Paris. And she and her team did a lot of work, so more than 10 years of research in organisational culture in business systems, again with globalised workforce. And then they did another 10 plus years of focus groups with training and discussions to refine that research. So they have mapped cultures across 8 different scales. And when I first read this book over 5 years ago or so, they'd mapped about 40 countries. Now it's over 70. So the work is ongoing. So these are the 8 scales. There's 2 ends. It's static. Now this is one tool in your toolbox. Like everything, it's not the only answer or the panacea, but it is a helpful thing to consider. So today we'll focus on communicating from low context to high context and evaluating direct negative feedback to indirect negative feedback. So there are valid concerns about stereotyping. Again, we all feel that we're very different. So if we look around in Australia, There's a whole range of people. We're not all the same. There's different subcultures, be it organisational work cultures, work teams, personality, the list is endless. Now, specifically in Australia, our Aboriginal and Torres Strait Islander peoples are not mapped. They're not included in the bell curve that is Australia. There are very different ways, and I don't want to make any assumptions of similarity. So my advice here is talk to your colleagues who are Aboriginal and or Torres Strait Islander, and like with everyone, be curious. Erin Meyer acknowledges there's a spread between cultures, and so like a lot of things, it's a bell curve, and so basically the culture determines the norms or the acceptable behaviours for that group, and then the individual kind of determines where they sit within that spread. So culture and personality at play, and the mapping of the culture is the peak of the bell curve. And so on this slide, there's an orange and a yellow bell curve that intersect, and so that's, there are similarities between India and China on this image. And really, it's about relativity. That is the most important thing. It's not the absolute position, but where do we sit relative to others? So here's our hypothetical messy scale. Someone from the UK comes to Australia and goes, "Oh, Australians, you're so messy, you leave rubbish everywhere, it's disgusting." And then a Singaporean business person goes to the UK and goes, "Oh, you're so messy, there's rubbish everywhere." And so on and so forth. So it's about, what you're used to and those differences. In my experience, travel is a great eye-opener for seeing those changes. So moving on, the very first scale is communicating. As we know, communication failure is by far the most common explanation when it comes to figuring out what goes wrong in life, in work, in lots of things. So the scale for communicating, the two ends is low context and high context. So low context communication is considered precise, simple and clear. Messages are expressed and understood at face value. Repetition is appreciated if it helps clarify the communication. So in low context communication, the emphasis is on the content. The words said using explicit, direct, unambiguous verbal messages, with the focus being on honesty, truth, and the exchange of literal information. In high context communication, this is considered sophisticated, nuanced, and layered. Messages are both spoken and read between the lines, and messages are often implied but not plainly expressed. So the context is more important here. So that can be the physical setting, the previous relationships between participants, and non-verbal behaviour. Another example in physical setting, high context communicators, it's often about sharing meals and sharing those rituals. Whereas low context, we don't want to, we'll have a working lunch or something to value your time. Now, context also has to do with the amount of innate and largely unconscious understanding a person can be expected to bring to a particular communication setting. So the speaker doesn't say what they mean because they know and understand each other quite well, and the way the interaction unfolds implies the meaning without hurting people's feelings and maintaining harmony. Now, email can be particularly problematic with high context communication because there's really no room for implicit meaning. So email, SMS, other things. Now, this scale makes it seem clear cut. Now we know that real life is messy, and it's not that binary. But it's just understanding there are those potential differences. Some other bits about low context. In low context settings, you say what you mean and mean what you say. Tell them what you were going to tell them, then tell them what you have told them. Does that sound like learning objectives? Active listening allows you to clearly understand meaning, and the responsibility for communication is with the speaker. Whereas in high context communication, hear what I mean, not what I say. There's a French saying of under the hood, or you read the air. Apparently everyone understands the unwritten rules, and if you've grown up in that context, that helps. And the same word can have different meanings depending on context. So the Hindi word for yesterday and tomorrow is exactly the same, but the meaning comes from the context. We did fact check this with some colleagues. And the responsibility to understand is with the listener. So very different. So here we've mapped a number of countries across that continuum from low to high context. It's not complete, but the countries I've chosen are pretty much the list where our medical graduates come from, if they have been mapped, because not all cultures have been mapped, but also, who do we align ourselves with? So our health system, and we're still we're not a republic, so the Brits, the Canadians, and our local neighbours, so New Zealand, China, Japan. Where countries and cultures sit on the map is also thought to be related to the history of those countries. So for example, Australia and the US are very young countries in relative terms, with a short history of European settlement. So that low context communication was a necessity because there wasn't that shared understanding of language and meaning. So communication did need to be simple, clear and precise. Whereas Japan, at the other end of the scale, has a very long history of a stable island setting, monocultural, minimal migration, and quite isolated. So there's a lot of shared context and understanding. So less is explicitly said. The American anthropologist Edward Hall, who originally developed the concept of low and high context communication while working on Native American reservations in the 1930s, often used the analogy of marriage to describe the differences between high and low context communication. So imagine what happens when people have been married for 50 or 60 years. They've shared the same context for such a long time that they can gather a lot of information just by looking at each other, just that one stare. Whereas newlyweds, they really need to state their messages quite clearly and explicitly and repeat them frequently to ensure that they're received accurately. And so that comparison with longer or shorter shared histories makes a lot more sense. This is another activity for you to work on alone or with a team. So these 17 statements here, they're a mix of low context or high context. Have a read through them and have a think of, what's low context or explicit and what's high context and implied. Also have a think about what your preferred communication style is, and as well as realizing that there is a culturation and there is a changing. How long that takes depends, like lots of things. Here we have the purple are the low context statements. Number 5, it's best to tell it like it is. And the black are the high context statements, like yes means I hear you. I wanted to just share an example about communicating in Australian general practice training. So I was involved in GP training for many years. Now, I was asked to do an external clinical teaching visit for a registrar who'd repeatedly failed the RACGP clinical examination called the OSCE. And so ECTV is a direct observation. And so the focus was feedback on communication and consultation skills. Now, over the first couple of consults, I felt like she was ignoring patient cues. The first patient was really worried about a possible, cancer diagnosis. And so we talked about the need to acknowledge and respond to cues and came up with a phrase that the registrar could use with every case, something like, I hear that you're feeling concerned. Now, after having read this book and understanding cultural communication, I'd potentially approach this differently. So this registrar had trained in China and was a well-respected paediatrician before migrating to Australia and undertaking GP training. So with the understanding of low context and high context communication, so this registrar was being respectful because in China you don't explicitly identify emotions in the same way that's expected in Australia. So when we talked about the cases, she could understand what was going on, understand the concerns, appropriately managed, but felt it was respectful to not explicitly mention the anxiety and concern. So a different approach would now be RACGP's clinical exam is an exam to assess competence to practice independently in an Australian context. In Australian culture, it is expected that you would explicitly acknowledge the emotional cue so the patient clearly knows that you've heard them and have understood them. And that helps that therapeutic relationship. It's very interesting to stop and reflect on our communication if we're working in different settings or between different cultures. People in low context cultures may wrongly perceive high context communicators as secretive, lacking transparency, hiding their real opinion, untrustworthy, and lacking clarity. So there's lots of judgment there, and that's, because things aren't being explicitly said. Whereas people in high context cultures may wrongly perceive low context communicators as inappropriately stating the obvious, condescending, patronising, judging others as stupid. That's because often we're repeating the same thing to ensure there's clarity. And it's also part where low context communicators, the speaker's responsible, and high context, the listener's responsible for understanding. Now, another interesting thing is that a lot of miscommunication occurs between one high context culture and a different high context culture. So assumptions are made, but they may be inaccurate. It's important to discuss saying no in different cultures. So saying no between the lines. Now, it's really common throughout many Asian cultures to, especially speaking to a boss, a client, or an elder, that saying no between the lines or in a kind of nuanced way happens versus an explicit no. I had a previous GP registrar who was working in an area of Sydney where there was a high population of her community elders. They would come to see her, and she was finding it increasingly difficult to practice the sort of medicine that she wanted. So also as a young female, it was challenging to say no to elders. And so she moved practice to try and manage that. Kath has an example of playing Pictionary with a team of volunteer leaders, and there was a teammate, Sam, from China. And so he drew a circle, someone said moon, and he said yes. Someone said ball, he said yes. Someone said plate, he said yes. At the end, no one knew what it was and they lost. However, it opened up a conversation about how to say no in a different way or to voice concern. So when Sam said things like, have you thought about this alternative view? His peers could stop and listen to his concerns. In Iranian Persian culture, the norm is that you say no 3 times before you say yes. So say you're at someone's house and they're offering you a food or a drink, you say no multiple times first. Again, that takes experience. And then we've got, consent issues in Australian culture where no means no. And if you keep asking people, then you're harassing them. So it's a balancing act. So having a think about how, and again, the hierarchical level of medicine and, juniors, but even if you're peer-to-peer in as a supervisory context, what does that look like? What's the body language? So this scenario is from the book. And so Mr. Diaz was a Spanish executive working in China for a textile company. Now he states, in China, the message up front is not necessarily the real message. My Chinese colleagues would drop hints and I wouldn't pick them up. Later, when thinking it over, I would realise I had missed something important. And he recounts this conversation he had with Mr. Chen, one of his Chinese employees. So have a read and then have a think about if Mr. Chen was coming to work on Sunday. Mr. Diaz was certain that Mr. Chen was coming to work, and Mr. Chen was certain he had communicated that he absolutely would not come because he was going to be celebrating his daughter's birthday with his family. Mr. Diaz's top tip was, if I am not sure, I have to take responsibility to ask for clarification, because in China it's the responsibility of the listener to ensure they have understood correctly. So this is another opportunity to reflect or to chat in a pair or a table team environment. So having a think about what situations in your educational and professional setting may be impacted by cultural differences in communication, what relationships could be impacted, and how could you approach these situations where cultural differences are impacting on communication. Some examples for you to think of as well. So again, thinking active listening is very, very low context communication, but we take it as normal. Thinking about different negotiation styles, be it for rostering or even setting up an appointment to do a term assessment. If you've got team meetings or committee meetings, people speaking up. Also thinking about, clearly we've been talking about communication styles, but language and pausing and translating will be playing into that. So the second scale is evaluating performance and providing negative feedback. So positive feedback is smooth sailing. No one really generally complains about that. But we've all got stories where we think back and go, oh, I could have done that better, or I missed the mark, or, is there something else going on? And so, as I said earlier, this is just another tool in your toolbox, and it's often something to consider if things aren't going to plan or they're not going well. And it's just another frame to consider. Also wanting to acknowledge that ideally, in the ideal world, feedback's bi-directional conversation. Many models that you can choose from, many things to consider. We all bring stuff with us to that feedback conversation. And as we learned today, it's one piece of the puzzle. So those principles of curiosity and intention, but focusing on the language used rather than the feedback model. And just thinking, could there be cultural norms at play, especially if things aren't going as I was expecting. So this is the scale. So at one end, we've got direct negative feedback. This is delivered frankly, bluntly, and honestly. Messages stand alone and they're not softened by positive ones. Absolute descriptors are often used. Criticism may be given to an individual in front of a group. And that's often quite a confronting thing. When I say that, I mean often, so in the Australian setting where we are, we do a lot of group teaching. We ask people to volunteer. And for us, because we're used to it, that seems quite low stakes. But for some other cultures, that actually can be quite intimidating. Indirect negative feedback is provided softly, subtly, and diplomatically. Positive messages are used to wrap negative ones, and qualifying descriptors are used, and criticism must be given in private. So actually in the book, they talk about scenarios where people have resigned because feedback was given in a group setting. That, you read it and think that's quite soft and low stakes. So when we talk about those descriptors, so these are the countries mapped. Again, it's all about its relativity, but Australia has moved a bit more to the centre than where we were on that communication access. So these are the qualifiers. So upgraders are used to strengthen the message. They emphasise the importance and they're more direct. Things like absolutely, definitely, unacceptable, inappropriate. Downgraders soften the message and they decrease that personal impact and they're less direct. So maybe, perhaps, you could consider, have you thought about, what do you think? Even saying them, you feel a tone change. This is the communicating and evaluating scales on the one page because they're not linear. It's not a direct correlation, which means that we then end up with 4 different styles, which we will go through. But just that quick visual of, what's your cultural background? Where do you sit? Where's Australia? What are other countries to look at? So Japan has pretty much stayed in the same position. Most others have moved a bit. So here are our 4 quadrants. So group A have got low context communicators and direct negative feedback. So these are considered blunt, rude, offensive. Messages are simple, honest, transparent, and they're respectful of your profession. They're not meant to cause offense. Don't take it personally. So us Australians, we sit in here. We are a bit more to the centre, and we're with our Dutch, German, and Danish colleagues. The group B, so we've got high context communicators who give direct negative feedback. So they read between the lines, but that direct feedback can be quite harsh and startling. It's often given to subordinates, and praise is often given sparingly in these cultures. So here we've got Israeli, Russians, and French. Group C, so we've got low context communicators and indirect negative feedback. So very transparent communicators, clear, direct, but really soften the feedback, which can be so confusing. And so there's that 3 positive messages to wrap the negative message in the USA, for example. People leave very confused. So US, UK, and Canada sit here. And then in group D, we've got high context communicators and indirect negative feedback. This group, very important to not give individual feedback in a group setting. And feedback is given slowly over a period of time. And there's this concept of blurring the message. So for example, if you're in one of the countries here, so Japan, you might be taken to a meal at your favorite restaurant and you'll talk about a whole range of things. You'll get given positive comments and then you'll leave. But by omitting the negative, the receiver clearly understands the missing information. A colleague today shared a story of having a trainee from China who in the 1 week had received 3 positive feedbacks, 1 from a nurse and 2 patients. And after each positive feedback, he came into the office going, where's the negative? What have I done wrong? What am I in trouble for? And actually without this understanding, you'd be like, but you're doing well. I don't understand. So it's really eye-opening. It's really important also that if you are working in different countries and cultures, to not adopt the style of the home country that you're in, because you may miss the nuances. Whereas like a lot of things that we do, it's that framing and that signposting. So in Australia, we do X, Y, and Z, or the expectation is. I wanted to give an example that's in the book. So there's a French executive working in the US, and Erin was meeting with both the French person and the US boss. So the French worker's saying, oh, best job I've ever had, best feedback I've ever had, amazing. American boss is saying, oh my God, I have to fire her. She's not listening to me. I've provided so much feedback. And when those experiences are polar apart, there's been misunderstanding and miscommunication. And really, so if we think the French, very direct, blunt feedback, Americans, there's all this effusive praise, the negative is buried. It's really hard to hear. So just, but messages and labels like resistant to feedback, lacking insight, are often used and heard in these situations. So it's just a moment to pause and think, could something else be going on? Another activity for you to practice. So these phrases written here are indirect statements, and it just gives you an opportunity to reword them in a more direct language. So statement number 1, this is an interesting viewpoint. This can be interpreted as, oh, I disagree with you, I don't agree, you're wrong, we need to talk more about it. So just when I've done this, everyone's automatically cottoned on that interesting usually is negative, but that can have multiple meanings. So just having a think about that. And it's important to note that being direct does not mean being rude. So being polite and respectful with those direct messaging. A little bit of fun with the next slide. So this is the Anglo-Dutch translation guide. So when the British say with all due respect, the British mean I think you are wrong. The Dutch understand he's listening to me. When the British say, oh, by the way, the British mean the following criticism is the purpose of this discussion. The Dutch understand this is not very important. When the British say, I'm sure it's my fault, the British mean it's not my fault. The Dutch understand it's his fault. It's a bit of fun, but there's lots of truth to it. Again, when we present this, lots of nods in the room. So have a think about what are the unwritten rules in your workplace, team, family setting, and how have you learnt those unwritten rules, and how do we make them explicit? Often it's that a mistake is made before people go, oh yeah, we didn't tell you this is how it works. So how can we, help our colleagues? The next activity, noting that it's a static bit of feedback, and feedback is usually hopefully a conversation, but not in every setting. So I've just got a little scenario of direct versus indirect feedback in the context of entrustable professional activities with a medical record review. So an example of direct feedback. I've reviewed your medical records based on the consultation just observed. In future, make sure that you've checked for spelling errors and that grammar is correct. It is inappropriate to have information about allergies missing, especially when writing prescriptions. This is a patient safety matter as well as important for medico-legal reasons. You must clearly document that you advise the patient of when to return to ED or when to see their GP before discharging them home. Indirect feedback. I reviewed your medical records. May I suggest you review the patient details page so you record the allergies before prescribing? What do you think? Think about your safety netting advice. Would you consider any changes to your notes? So again, those different words and qualifiers, right? And also noting those, hierarchical elements at play that we haven't discussed. Another activity for you to do with your team at work is there's a role play scenario here, again in that kind of EPA setting. Also try to look for upgraders and downgraders that are used in your debrief. And then have a think about what is your cultural preference for giving and receiving negative feedback, and how you might ask someone what kind of feedback they like to receive. So it's important that we know ourselves, because often that's the style we kind of use because we're comfortable with it, and we often see the world through our own lens. So if someone is more used to direct feedback, we may feel as though our feedback is not being heard and not being taken seriously. But if someone is more used to indirect feedback, they may be hurt or defensive about feedback they perceive as rude, judgmental or harsh. We do need to talk to our international medical graduates about the Australian culture and way that we do provide feedback, recognising we are a diverse bunch and there's lots of factors at play there. So also thinking if you prefer direct feedback, then take out the downgraders and hear the real message. However, use downgraders when you're providing feedback. And if you prefer indirect feedback, take the message as it means literally. Don't be offended, as the message is about respecting you and not about hurting you. Some examples we've heard in delivering this is, and it demonstrates great self-awareness. So Junior, who said, I need to hear the positives and the negatives at separate occasions so that I can process them. So flagging that and then making time. Or some supervisors who've said, I have a very direct style, that doesn't suit everyone, do let me know and I can modify. So again, that warning of what is coming. Nearing the end and being explicit as a low context communicator, here are some tips that you might find helpful. So really just creating spaces for open conversation about different communication styles and the things that impact that. So with cultural background being one of them, and noting the diversity within Australia. And then thinking also how someone looks is very different, and we're humans are judgy. We judge people within seconds of meeting them, and so that external appearance is one factor. Then they speak and you hear is it an Australian accent, is it from another country, but they may have grown up somewhere, studied somewhere else for medical school, done junior doctor training elsewhere, so we really don't know the story, so best not to make any assumptions but to have a think about those things. Remembering that communication between one high context and another high context culture can lead to miscommunication, and how many versions and edits are occurring. Thinking about team dynamics, supervisor-trainer relationships. And it's all about cultural relativity. And this is just another tool in our toolbox, and thinking about our personal preferences for communication and feedback. And again, those open, curious conversations. And that cultural adaptation does occur over time. So, next steps. The other consideration I wanted to consider is thinking about where our colleagues have come from. Have they come from war-torn lands? Have they come from low-resource settings? And so some of those other, trauma considerations. So, has anything sparked your curiosity? What do you want to know? Do you want to go and read Erin Meyer's book? I recommend it. As I said, lots of aha moments. Are you replaying a conversation or a situation that has occurred that you've been grappling with, and maybe it's time to have another go? And often just saying, hey, look, I think that conversation or feedback or whatever it is missed the mark. Can we try again? I've had a think, and maybe this is what might be going on from my perspective. It might not be the answer, but it starts a process of better understanding. There's also a culture map website, Erin Meyer's website, and there's this fun little country mapping tool. There is a subscription, but you can input as many countries as you want, and if they've been mapped, then they're mapped against the 8 scales. This is the one for the countries with most medical qualifications that were done, and then I actually put my different family members in there for fun as well. So again, low context explicit. These were the learning objectives that we covered. Here is my email address if you have any questions or want to get in touch. So thank you, and I hope that this has been valuable. Bye.